Take a look at this. At Eagle Creek Park, we saw a lot of families who were still getting some fresh air today. People had to wait in line to get in the park, but once there, question is, how did it go for them?
Most people seem to be keeping their distance pretty well, staying in family groups. You don't see a lot of masks. No one's really wearing a mask or anything like that.
Do you have any concerns?
No, especially not out here. Fresh air, exercise. I think that's the healthy choice.
And another sign that things are different this year, city pools are still closed on what's typically a huge opening weekend. And while some people are following the rules, take a look at this, others did not. This is video from the Lake of the Ozarks in Missouri. It has likely been all over your Facebook page today. This bar's pool is packed with people, as you can see here, shoulder to shoulder. They are simply not social distancing. And we're also seeing this as the World Health Organization gives a brand new warning about the spread of COVID-19. They say that there could be a second peak of coronavirus cases if people simply are not careful.
We cannot make assumptions that just because the disease is on the way down now, that it's going to keep going down, and then we're going to get a number of months to get ready for a second wave. We may get a second peak in this wave. This happened during pandemics in the past. It certainly happened in the pandemic of 1919 and the Spanish flu. We got a second peak, not necessarily a second wave.
The WHO also says enforcing public health and social distancing rules will help prevent cases from actually spiking.
No coronavirus update from the governor today because of the Memorial Day holiday, but we did get new numbers from the state. It shows how COVID-19 is impacting Hoosiers living in those long-term care facilities like nursing homes. So take a look at this pie chart. Deaths in long-term care facilities now make up nearly half of all COVID-19 deaths across Indiana, about 48%. 876 people who've lost their lives, many of them among our oldest Hoosiers. But when we take a closer look at the cases among long-term care residents, there is a glimmer of hope. Now, this chart shows you the number of positive cases that we've seen. Now, as of the last 4 weeks, we've seen it nearly triple. But here's the bright spot. We're actually adding fewer new positive cases each week. Last week, in fact, we added the fewest number of new cases in long-term care facilities since Indiana started reporting numbers. We'll keep an eye on that.
You may have seen the headlines that 1 minute of talking releases 1,000 droplets, or that loud talking could leave the virus in the air for up to 14 minutes. You asked us to find out where this was coming from and if it was true, so we're verifying. Can you spread COVID-19 just by talking? Our sources are the National Institute of Health, the CDC, and a scientific study from the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK. This study by the NIDDK measured the number of droplets that come out of our mouths when we speak and how long they linger in the air. Since droplets are known to spread COVID-19, the experiment wanted to find out if normal talking would cause them to spread. They found, quote, a substantial probability that normal speaking causes airborne virus transmission in confined environments. The NIH also recently released this video explanation of their findings. They use a green laser to highlight droplets in the air. First, they test it with a spray bottle. You see a lot of green specks. Then they test normal breathing, almost no droplets. Then they try talking.
Stay healthy.
All those specks show droplets in the air from talking. The NIH experiment and NIDDK study both back this idea. And when we asked the CDC, they also confirmed that speaking can spread contagious droplets. Okay, but what about how long it can stay in the air? Is it really 14 minutes? Well, the study did measure about 14 minutes, but that was in a controlled lab with no airflow. That number would drop in real-world settings. Bottom line, we can verify that COVID-19 can be spread just by talking. And all 4 of the agencies we sourced say these findings are a reason to wear a mask in public. Have more questions for us to look into? Send us an email. With your Verify, I'm Jason Puckett.
Jason, thank you so much. Now, here are 3 other things that you need to know tonight about the coronavirus right now. There is still time for you to sign up for Kroger's final 2 days of free testing on our city's west side. In fact, it's going on tomorrow and on Wednesday at Ernie Pyle School 90. You'll need to fill out a form in advance to see if you're eligible for that free test. You can get the process started online. We've posted a link for you on our website at WTHR.com. And a warning tonight for those of us who are working from home. Police departments say car break-ins are now on the rise nationwide with less people out and about. Here's how it is. The car sits in your garage or your driveway, and you may not check it for days or even weeks at a time. Well, for criminals, it's low risk and potentially a high reward. So make sure that your car is locked and that you don't have any valuables inside. And also tonight, did you get your stimulus check yet? The IRS says more than 3 million Hoosiers have it, totaling more than $5 billion. If you have any questions about your stimulus check, you can go to check out the resources at irs.gov.